been a charge nurse in the trauma and surgical ICU for 5 years now. She's a relief charge nurse, and she does a lot of precepting too. Anjelica was nominated for the time that she spent helping one of her patient's family members. I was taking care of this lady whose husband had actually he had shared with me that he was a patient previously at UMC. I was taking care of her one day, and she was pretty sick. She was going to have surgery, and I just noticed that he was having a harder time getting around that day. And he said, well, my foot is just really hurting me, and I feel like I might have an infection. And since she was going to surgery that day, I told him, you're gonna have a few hours where you're not doing anything. You should really go see someone about your foot and make sure it's not infected. And he really didn't want to go to the ER because he knew that he would probably have to wait a while, and he didn't want to miss his wife coming back from surgery. So I called and I made him an appointment for shortly after she would be going to surgery. And he came back and was really happy because he did in fact have a pretty bad infection, and so he got some medicine for that. He was put on some antibiotics and some pain medicine. I felt like I would have done that for anyone, because I would hope that if it was my family and they didn't have anyone else there that were taking care of them, I would hope that someone would step in and make sure they were taking care of themselves too. Anjelica is such a passionate nurse. She comes to work every day with a smile on her face, ready to help others and excited about her job.